Hi, I'm Mara.
And I'm Jessica.
We're going to talk to you about types of ineffective listening as described in Chapter 8 of the book Looking Out, Looking In.
Ineffective listening. Listening effectively is not always the easiest thing to do. For instance, think of a time when you actively tuned someone out. Why did you do it? There are many reasons why people choose not to listen to others.
There are many reasons for ineffective listening. For instance, the speaker may be talking about something uninteresting to you. They have no enthusiasm or tone to their voice, so it's hard to pay attention. Or you might just be distracted or too busy thinking about something else.
There can be consequences to ineffective listening. In healthcare, professional, or personal settings, ineffective listening may lead to deterioration of relationships, missing of important information, and poor patient outcomes. Improving your listening skills. The good news is that if you really want to make an honest effort to understand what someone important to you is trying to say, you can recognize and work on any ineffective listening habits you may have.
There are many different types of ineffective listening. These are the ones that we will be describing: pseudo-listening, stage hogging, selective listening, insulated listening, defensive listening, ambushing, and insensitive listening. Pseudo-listening is a limitation of true listening in which the receiver's mind is elsewhere. They're giving the appearance of listening when really they're probably busy thinking about something else or bored and tuning you out.
A tired MLT is at a hospital interdisciplinary meeting where she should be paying attention, but she's got a lot of things on her mind, so she's only pseudo-listening. Maybe she has a new analyzer to calibrate, maybe she has to order something for the lab, or maybe she's just thinking about what to make for dinner tonight.
In stage hogging, the receiver is more concerned with making a point rather than understanding the speaker. They either make the conversation all about them by shifting the conversation to something they want to talk about, or by interrupting the speaker.
In this example of stage hogging, a doctor is consulting with another specialist for advice on a particularly difficult case. The specialist is quite brilliant, and she knows it. Let's watch and see.
Hi, Dr. Burrell. I was wondering if I could get a consult on a really difficult coronary case.
Oh, coronary case? I just wrote a paper on cardiac disease. Do you want to read it?
Actually, I just need to talk about the patient. I'm looking at something along the lines of coronary syndrome.
Coronary syndrome? That was my specialty. Are you sure you don't want to read it?
I actually just need to talk about the patient.
Oh, okay. Your patient's probably going to be fine.
I don't think they will be, actually.
Why is that?
You know what? Maybe I'll go talk to somebody else. Thank you.
No problem. If you want to read that paper, though, get back to me.
Okay.
In selective listening, receivers respond only to messages that interest them and reject all other information. This can be useful when pulling relevant information from commercials or advertisements, but when done to an individual can be hurtful and insulting.
In insulated listening, the receiver ignores undesirable information. When a topic arises in a conversation that the receiver would rather not deal with, they just nod or answer in agreement and immediately forget what you said. They either fail to hear or acknowledge.
In this healthcare example, a nurse is advising a patient on the consequences of her lifestyle choices: bad eating habits, drinking, smoking, etc. The patient views this information as undesirable and is not focusing on what is being said.
Defensive listening is when the receiver perceives the speaker's comments as an attack. When the receiver is asked about a topic that they feel insensitive or insecure about, they will get defensive when asked about it, even if the speaker did not intend to pry.
Ambushing is when the receiver listens carefully in order to gather information to use as an attack on the speaker. The receiver is listening, but for an alternative motive to use the speaker's own words against them. This usually makes the speaker defensive. Here's an example from a popular TV show called The Office.
You can't be sure that it wasn't you.
That's ridiculous. Of course it wasn't me.
Marijuana is a memory loss drug, so maybe you just don't remember.
I would remember.
Well, how could you if it just erased your memory?
That's not how it works.
Now, how do you know how it works?
Knock it off. Okay, I'm interviewing you. No, you said that I'd be conducting the interview when I walked in here. Now, exactly how much pot did you smoke?
Insensitive listening is when the receiver fails to recognize the thoughts and feelings not directly expressed by the speaker. For instance, the receiver will take the speaker's words at face value and not look beyond the words and recognize the hidden meanings in their tone and choice of words. By recognizing the ineffective listening skills presented in this video, we hope you can challenge yourself to work on the ones you feel you may be weak in. This will help to build better relationships professionally and personally. Thank you.